Okay, let me start session 45 on turning our shared COVID-19 experiences into collective multilateral actions to build resilience for vulnerable members and groups. By thanking you all to join us and welcome to this session. As you can see from the main theme of this session, there are three main points we are keen to explore. Namely, first, what are the shared experiences and lessons we have learned so far in relation to addressing COVID-19? Second, whether and why the vulnerable WTO members and vulnerable people are most devastated and the existing inequalities are exacerbated. And thirdly, whether certain collective multilateral actions under the WTO are needed, in addition to the actions taken by individual members. Let me start by saying a few words about the shared experiences to warm up our session. It is apparent that when COVID-19 became an extraordinary pandemic, the WTO and its members collectively were not ready. Therefore, we should not let such unpreparedness happen again. How to ensure that the WTO and its members collectively are prepared for the future public health crisis of similar scale is surely a critical issue. Second, it is also apparent that many WTO rules are already there, but some of them might have been ignored by members when taking trade measures. Some other rules might be unclear so that members could have different understandings, which lead to different approaches. Third, WTO's decision-making process might not be efficient enough, and members could have difficulty in compromising on some critical issues. The discussions on TRIPS waiver are an example showing the difficult situation when the WTO is to make important decisions. We also see very positive development at the WTO. Currently, there is an ongoing multilateral process on WTO's response to the COVID-19 pandemic. We are yet to see the result of the discussions, but we can be optimistic that members are working hard on deliberating a comprehensive response to the pandemic at the multilateral level. This also shows the importance of collective response to the challenges and the risk that the whole humanity is encountering. Finally, we also identified that there are deteriorating economic inequalities arising from public health crisis, that the practices of some members can serve as best practices, and that it is of high importance of cooperating with private sectors. After having said all this, in our session, we hope some, if not all, of these shared experiences can serve as the basis of our brainstorming exercise. We are pleased to have 4 excellent speakers to address relevant issues. Their topics cover the possible inadequacies and the need of addressing vulnerable countries and people. Each speaker will have at the most 8 minutes for his or her initial presentation. After their presentation, I will collect some questions for them to respond. Our first speaker is Professor Lin Caiyu, professor at National Taiwan University and the director of NTU's WTO Center. She is to address the inadequacies of the existing WTO law to respond to the COVID-19 challenges. She is going to use medical export restrictions as an example. Caiyu, please, you have the floor.
Thank you, Chair. It is my great honor to be part of this session. Why this topic? As we see, countries around the world have taken various approaches to fight the COVID-19 virus. Pandemic responses in the form of trade measures particularly underscore the central importance of WTO law in health crisis. The pandemic provides us an opportunity to look into how WTO law may contribute to the linkage between domestic public health needs and the global infectious disease control, whether current WTO law provides an adequate solution for the COVID-19. If not, what can be done for future pandemics? To explore the issues, here I'd like to use medical export restrictions as an example of discussion. There are some issues arising from medical export restrictions in pandemics. According to the WTO, over 85 countries had introduced export restrictions in the early stage of the pandemic. Around 58 of the products focus on protective personal equipment, medical equipment, or pharmaceuticals. Nearly 60% of these restrictions are still in place. The surge of the restrictions reveals that there is an urgent need of the exporting countries to prioritize their own populations and domestic use in times of health crisis. However, on the other hand, such export restrictions will negatively impact other importing countries. For instance, they may cause supply chain disruption. They may magnify the global shortage. As a result, the essential products in world markets are reduced. Moreover, they will endanger access to medical supplies throughout the world. In this regard, import-dependent poor countries without manufacturing production capacity will be hit most. Let's move to the current WTO law. GATT Article 11.2 and GATT Article 20b are the most relevant provisions for members to justify restrictions. As Article 11.2a states, export restrictions temporarily applied to relieve critical shortages of essential products to the exporting members can be allowed. Medical export restrictions to preserve national suppliers to fight the COVID-19 can be justified. At another level, Article 20b allows measures necessary to protect human life or health if these measures meet the sample. It appears that medical export restrictions to protect populations in the COVID-19 will fit as long as they are subject to the requirements such as non-discrimination and necessity. In light of the above, however, neither GATT Article 11.2a nor GATT Article 20b provide a positive response to the interest of importing countries or to address global supply chains concern. Therefore, as the current WTO law can serve the interest of importing countries and the most vulnerable in health crisis. In my view, WTO law needs a more balanced approach to cope with future pandemics. Here, I propose that there should be additional rules subjecting medical export restrictions to stricter rules, substantively and procedurally. The additional rules will operate in parallel to GATT Article 11.2 and Article 20b as a supplement or clarification. New rules will include elements of other agreements here. For example, agricultural agreement, farmer agreement, GATT Article 20J, and WHO International Health Regulations, i.e. IHR. When to apply the additional rules, WHO's declaration of a public health emergency of international concern, PHEIC, can serve as a trigger point for the application of additional rules. Recall, COVID-19 is the 6th PHEIC declared by the WHO. When is the additional context? where is the additional rules context? In my view, agreement on trade in pharmaceutical products, pharma agreements, can be used as a context. It is suggested that the coverage of the pharma agreement can include essential pharmaceuticals, related ingredients, essential medical supplies, personal protective equipment, or vaccines, just subject to WHO confirmed vaccines. What are additional substantive requirements? In the context of GATT Article 11.2a, there are two dimensions. First, on the new requirements part, for instance, exporting countries need to consider the effects of the export restrictions to importing countries. All WTO members are entitled to an equitable share of the international supply of the medical products. Poor countries should be given access guarantee to reflect the special and differential treatment. Second, on the clarifications part, some new factors are relevant to determining shortage of a supply in GATT Article 11.2a. For instance, the reliability of transnational supply chains, the availability of supply from both foreign or international sources could become relevant. In the context of Article 20b, more clarifications can be provided to interpret the necessity test. Under the necessity test, there is a need to engage in the process of weighing and balancing. For instance, on the factor of the importance of an interest or values, the importing countries' interest in equitable share of global production, reliable transnational supply chains should be taken into account. On the factor of the extent of the contribution to measures objective, the essentialness of the product's nature of shortage should be taken into account. On the factor of trade restrictiveness, whether the measure is of temporary nature, the level of reasonableness should be taken into account. For countries here, their access guarantee should be deemed justifiable. Final part, what are additional procedural requirements? It is suggested that members should do quick notice and provide necessary information, such as evidence, technical data, to the WTO. The WTO in turn should share the notification information with other members. The WTO may request the member concerned to reconsider the application of the restrictions. Let me conclude my presentation. Thank you for your kind attention.
Thank you very much, Tsai, for your presentation, which is with quite a number of valuable points, including that there is a need for a more balanced approach in applying WTO rules by introducing new elements into the current practice. We will come back to you after all presentations and present to you some questions that we collect. Our next speaker is Professor Xue Jingwen, who is Associate Professor at National Zhengzhi University College of Management. She is to speak on how far can the WTO go in the path of economic empowerment of women after COVID-19, focusing specifically on possibilities and challenges. Jingwen, please, you have the floor.
Thank you, Ambassador. My dear colleagues and the audience, good morning. Thanks for allowing me to share some views about how the WTO can contribute to gender equality. In terms of economy, we found that women are more vulnerable than men in the days of pandemic. They suffer more income and job losses. This phenomenon should be corrected, otherwise the economy cannot be truly recovered, because almost all the empirical studies prove that the gender gaps cause great losses in GDP growth. Before proposing tentative solutions, I would like to explain why women have disadvantage in trade from three perspectives. First, women as consumers often pay more for the imported goods because of the higher apply rate to female consumptions. In addition to these discriminating tariffs, the tariff structure probably unintentionally favor male consumption. Second, women as entrepreneurs bear high trade costs as a result of running business, and they have relatively limited access to financial resources. Third, women as employees cluster mainly in less trade competitive sectors or firms. For instance, female-intensive sectors like food and beverages and textile leather faces higher import tariff rates. Also, women usually work in less trade intensive sectors such as education, healthcare, physical retail. The pandemic did not change the gender inequality, but simply amplifies it. The distant working and shutdown of the economic activities hurt female-intensive business more than the male-intensive ones. The pandemic also accelerated the phase of digitalization of the economy, which is even more challenging for women without enough skill to adapt to the new world. If we check the status of gender equality in 2021, we can find that the social role of women, especially as a mother, could be another cause of gender gaps in labor participation and trade. Considering these causes of inequality, we can either improve the trade competitiveness of female-intensive sectors, or we can try to relocate women to trade competitive sectors and firms. Either way is not easy and requires massive investment of resources. I think the latter one is a better goal to chase. If we want to intervene the competitive relationship, tariff reductions or subsidies seems inevitable. However, the measures do not guarantee women to enjoy the gains. Furthermore, there could be concern for protectionism. Job shifting could be ultimately improve the female economic situation. To reach that goal, women need to increase their mobility and flexibility to work so that they can handle the skill requirements and intensity of workloads in trade competitive sectors or firms. Social support for childcare and change of cultural bias capacity buildings are the keystone to the switch of jobs. Digital inclusion is also a must to close the gender gaps in trade. In order to wisely choose among all the proposals for gender equality, 3 questions are especially relevant. Should we take joint or unilateral action? Is hard law or soft law more suitable? Could gender-specific or gender-neutral measures be more effective? I would prefer the joint action because it will contribute the coherence of the trade rules and avoid unexpected trade divergence. I don't think hard law can really help because the sanctions or infringement could adversely affect the women working in that section or sectors. In that state or sectors. But that does not mean that we should stay soft on the gender equality requirements. We can set specific and rigid obligations or codes of conduct to tell people what should do. In the meantime, we should also give guidelines and instructions to tell them how it could be done. In principle, gender-specific rules are better because the gender-neutral measures cannot prevent de facto gender inequality. If gender-specific rules are not practicable, gender impact assessment should be adopted instead. To conclude, WTO members could or should build stronger linkage between social support for women and trade agreements. They can do that by investment facilitation agreement or a labor chapter or a labor relative provisions or GSP condition on gender equalities. They can also foster digital inclusion through opening the markets for telecommunication infrastructures, or trade ad in SEM, education for females and girls, and capacity building. It is also desirable to conduct gender impact assessment on gender neutral provisions or trade negotiations. Last but not least, the discussion on the mismatch should focus on the improvement of access to financial resources. Thank you for your attention. Now, I'd like to pass the floor back to Ambassador Law. Thank you.
Thank you very much, Jingwen, for sharing your findings on women being more economically vulnerable as workers, as business runners, as mothers, and etc. And of course, filling the gap is important. The question is how. You have raised quite a number of interesting suggestions. We will come back to you later. Thank you so much for your presentation. Well, our next speaker is Dr. Yan Huixin, who is Deputy Executive Director of Zhonghua Institute's WTO and RTA Center. She is to speak on addressing public health vulnerability through trade policy, focusing on some reflections on the contingent relaxation measures on healthcare-related product. Huixin, you have the floor. You are muted. Please unmute.
Sorry. Okay. Thank you, Chair, and thank you for having me here today. I would like to share some thoughts on the issues about public health vulnerability through trade policy, using the recent development of contingent relaxation measures on healthcare-related products undertaken by WTO members as the example. I would like to first start with defining the concept of vulnerability. I define vulnerability as a country's essential goods face the following situation: high level of import dependency, which means high market share of imported product relatively to domestic products. The second situation is that the low level of domestic substitution. For example, the countries cannot find credible local suppliers. Then, in light of vulnerability issue underscored by the pandemic, many WTO members introduced trade measures as policy tools to alleviate the situation. First, let's look at the pandemic-related trade measures by country grouping. The figures shows that both tariff and non-tariff measures has been adopted by the developing countries and much more than developed countries. The bar in blue means the percentage of measures still in place. For the measures with trade facilitating effect, there is a need to consider to keep measures in place while terminating those measures with a trade restricting effect. As we can see from the previous slide, there are many liberalization measures introduced. Currently, these measures are implemented on a temporary basis. Yet if countries can take advantage of this price to open their economies and improve logistics, recent studies show that the recovery from the COVID-19 will be much stronger. Therefore, I like to suggest there are 3 dimensions of policy reform that can be further considered. Transparency, keep global supply chain going, especially for essentials. Upfront investment of cooperations. For the transparency dimension, the key initiative is to build a global data database system on essential healthcare related products to enhance information flows and disclose. A database system targeting essential healthcare related products can identify the real-time bottlenecks in the supply chain and provide countries and companies the ability to make informed decisions. In this way, distortion to the global supply chain can be reduced. And I believe this is particularly critical for MISMEs in the global supply chain. For this, a WTO task force can work on seeking for coordinated international cooperation with OECD and TAC that have great experience in monetary trend with data. And also the task force can also work on creating an information system similar to the agricultural market information system in medical supplies. For the second dimension of keep global supply chain goings, the first assignment is to start discussion on more discipline on non-tariff measures to limit trade discretion in healthcare related to goods during the pandemic. For example, there is a need to introduce possible rules for exporters requiring any restrictions not to exceed certain period of months. And I make an example as 3 months, maybe. And also for exporters, if any export limit resulting in lower exports more than certain percentage, maybe 50% example, comparing to the average of the year before the pandemic, then we may need some rules to such export restrictions removed. Another assignment under the Keep Global Supply Chain Goings dimension is to consider turning temporary measures into permanent. For some non-tariff measure with trade facilitating effects, turning them into permanent may be beneficial to all. For example, the measures of digital SPS certification, 24-hour inquiry points of trade, clearance system at major ports, and also allowing submission via single window. I think those measures provide us some best practice to ease trade impact coming from the pandemic. Further under this dimension is to promote regulatory harmonization of essential medical products to remove barriers like such as non-tariff measure or tariffs may also be a way to keep medical goods, medical supplies flowing. And the example of the non-tariff measures includes harmonization of standards of conformity assessment and licensing process. As for the tariffs, the WTO data shows that the MFN applied duty for medical supplies is 6.2%, and the MFN duty rate even more higher than protective cleaning product as high as 11.5%. Then as a conclusion, I will wrap up with the idea of upfront initiation in cooperative arrangement. There is a debate about the impacts of COVID-19 on structure of global supply chain. And for ensuring resilience, countries may consider special arrangement for specific supply chains through upstream agreement in the strategic goods with countries and companies. With this, I thank you.
Thank you so much, Hui-Xin, for exploring the very important concept of vulnerability. And you focus more on healthcare products, which is, of course, of high importance. Quite a number of very interesting points, including global database system. I thought this is interesting, and also regulatory harmonization of essential medical products, which should also be quite useful. Deserve our further discussions. If there are questions on this, perhaps we'll come back to you to discuss various aspects in a more in-depth manner. Thank you so much for your presentation. Last, of course, not least, speaker is Professor Chen Zaifang, who is Associate Professor of National Yangming Jiao Tong University School of Law and Technology. And he is to explore possible multilateral trade rules to enhance the use and supply of COVID-19 related technology and products in the fight against the pandemic. Of course, his focus will also be on the consideration of vulnerable groups and members. Zaifang, you have the floor.
Thank you, Chair. My topic, as the Chair has pointed out, is focus on how can we develop multilateral rules that is focused on specific products and technology. That is very important in the pandemic response. And first of all, I would like to point out perhaps a quite obvious observation that COVID-19 related products and technologies, of course, are the key to the pandemic response that we are going to and we have been doing. And we are talking about the related products, for example, vaccines and their raw materials, medical supplies, medical machinery and equipment, and PPEs. And we need to ramp up their productions, and we need to have them equitably distributed, reduce the costs associated with their trading activities, and we need to create the infrastructure so that everyone, including the lower income countries, can have them and use them in the fight against the pandemic. And another obvious point that I would like to make would be a coordinated and collective actions will help ensure achieving these objectives. A more difficult issue would be, what does the WTO have to do with these objectives, other than ensuring a smooth trade flow are part of my points. And even in that part, the trade flow part, those countries are already doing everything they think is necessary and helpful to ensure smooth import of the related products. So is it really necessary for WTO response here with regard to ramping up productions and what should we do here? And I agree that WTO response towards most of the goals stated above are not obvious. But my main argument would be, one, that they are still related to trade. These issues actually are related to trade. And two, collective actions from the perspective of trade rules are necessary. So that public health initiatives endorsed by, for example, WHO or other countries could be effective. So first, the global pandemic responses are hampered by export restrictions adopted by some of the members, many members actually, for those related products. And the fundamental cause I would like to point out of these trade restrictions measures is actually the actual or perceived insufficiency of domestic level protection. And also the negative effect of these restrictions are exacerbated by lack of manufacturing capacity in many parts of the world, including lower income countries. So this is very much a crisis that is made more serious due to trade measures. And because of these trade measures are part of the reasons for the crisis and difficulty that we have, it is the WTO who should stand up to deal with this issue. And the collective multilateral response in the WTO therefore needs to address the production issue and the distribution issue directly. I think that, of course, it is important to have rules against or regulate export restrictions, but the root cause also need to be addressed. And second, I also would like to point out that collective and multilateral actions in international trade are very important to support other global, maybe bilateral or individual pandemic responses adopted by the countries. The difficulty faced, for example, by the COVAX, the vaccine facility is an example that support actually is very much needed for many of the health initiatives. So my main proposal will be that we should consider to establish a platform to support ramping up production. And we should consider some of the more innovative and collective action, maybe not traditionally adopted in the WTO. So I propose that we should have an initiative that establish a platform that coordinates the funding resources, IP, assistance, and other kind of support that is needed for this kind of purposes. And the joint effort will start with a platform that focuses on the capability and capacity for production of many of the important products that we would like to have been covered today. And I think it will be a coordinated, large-scale public-private partnership project. And the goal is to establish a less concentrated and resilient model of production for the essential products. And the platform would address the difficulties that we mentioned earlier. But of course, the big question is how can the platform be built under the WTO? So I suggest an agreement could be considered, or other types of special arrangement under the framework, which would establish a framework that can create coordinated collective actions among members. For example, in this framework, the members would commit to provide donations and subsidies to the joint efforts to set up capacities of low-income countries, and to the agreement of the location of the products upfront. The member need to set up commitments in the form in this kind of agreement or arrangement. And we could consider to establish a facility that is at heart of this arrangement to identify the needs of the countries have and coordinate support to reduce, for example, duplications and fragmentations of the support, and also align the support to the needs that many countries may have. And of course, this agreement could include provisions to ensure smooth trade flow. And we could also include voluntary licensing and technology transfer in this program. And with regard to the trade flow part, it is more in line with the measures adopted by many countries. But I would also propose that we could include some of the mechanisms to ensure predictability and stability of the elections, not just individual countries that just do now and then, but instead we will have a coordinated mechanism. Maybe perhaps we have some kind of specific automatic mechanism to start for example, the tariff or tax waivers or reductions that a lot of countries are adopting now, and also temporary waiver of certifications, requirements, administrative procedures on imports of important products. Those are the things that many countries are doing now, but we should make it more stable in this program, so that companies they can take advantage of those more easily. And we could also consider to establish, for example, a joint free trade zone for those covered products that would automatically enjoy a lot of the mechanisms that we are talking about. And my conclusion is that we should rethink what the WTO should and can do in these type of situations. And my proposed agreement arrangement would a special framework that would reduce the need and the negative impact of restrictions for those products. And that would conclude my presentation, and I would pass the floor back to the chair. Thank you.
you so much, Saifang, for your presentation by arguing the importance of coordinated multilateral actions and explained why the WTO need to play a central role. Your suggestion of establishing some kind of platform to support ramping up production is also very interesting. Now we have completed 4 presentations. We have some questions. One is about more procedural. The question is the origin of all speakers, because participants came in late and didn't hear the introduction of some speakers. 4 speakers are all from the separate customs territory of Taiwan, Penghu, Kinmen, and Matsu. So they are all from universities or research institute in the TPKM. So this is first point. Another point is more of a general question, not addressing to any speaker, which is about the cooperatives. The question is, cooperative promotes inclusivity of marginalized people. How should WTO see its role in promoting cooperatives? This is a very interesting question, but as I mentioned, this is not relating to the topic of any speakers in our session. But I would like to briefly mention that the WTO is not against cooperatives as long as the operation of the cooperative is in line with WTO rules. If it is mandated by government or required or regulated by domestic laws or regulations, then the laws and regulations shouldn't discriminate. That is the basic rule. Other than that, the cooperatives can be established without any other restriction under the WTO. But I'm not quite sure whether the WTO can be used as and how can it be used, if possible, to promote cooperatives. So this is something that I perhaps can share. There are other questions, and let me try to pick up the questions, sometimes coupled with my observation of your presentation for you to consider or answer. For Professor Lin Cai Yu, your main point is to see the inadequacies of the WTO rules to effectively respond to COVID-19. So the fundamental question is, are you proposing to change the current rules or merely to clarify the existing rules? And do you consider that the existing requirement under GET Article 20 Chapeau, 20B, or 11.2a cannot serve as a proper balance between the need of imposing a restriction for some reasonable causes and the need of free flow of goods? So this is for Professor Lin. For Professor Xie Jingwen, you mentioned about gender specific. Can you give a specific example to show how to make multilateral trade agreement more gender specific, but still in line with non-discrimination principle? And you also mentioned a very interesting point, a very interesting suggestion about gender impact assessment on trade provisions or negotiations. How to make it as a requirement? Are you considering to make it as a requirement under the WTO? And if the answer is yes, how to make it as a requirement prior to negotiations, to expect members to conduct such gender impact assessment. For Professor Yan, a very interesting point in your presentation is the global supply chain data system on essential medical products. Well, I believe to many people, the general understanding is that more competitive members and more competitive companies will be more capable of utilizing such data system. Who do you think will be the main beneficiaries of such system that you suggest? Do you think this could really benefit the vulnerable groups, which might be in a disadvantaged position to utilize such data system? So this is a question, reducing tariff on medical products definitely could be a challenge to small and medium enterprises of the importing country. Why do you think a reducing tariff would help vulnerable people and vulnerable members against the pandemic? And for well, there is another question for Professor Yan. Your idea of regulatory harmonization of essential medical product is through bilateral setting. Do you think that we need additional multilateral rules to address this issue? And for Professor Chen Zhaifang, the emphasis in your presentation, one of them, of course, is the coordinated multilateral actions. Do you suggest that we need a new agreement for such purpose? Well, if it is yes, then it would definitely take a very long time to debate on the need to negotiate the content of a new agreement. How can we deal with the current pandemic? That is perhaps the thought of many people. You also mentioned about a joint free trade zone. Do you think it is fully compatible with the WTO rules? How does it operate? Would it be some kind of bilateral agreement, on the free trade zone? What could it be different from the normal FTAs that we usually see? also, well, I think that is about the question. There is another question. The WTO has proposed COVID-19 technology access pool to boost health product manufacturing, but failed to attract major vaccine players. How can we ensure a new agreement to produce different results from this COVID-19 technology access pool? So these are the questions that we've had. We do not have so much time, but the questions themselves reflects the importance of the topics that we've been now discussing. Can I give each of the speakers 2 minutes to respond, either all of them or some of them that you consider more important? Can I invite now Professor Lin Cai-Yu?
Thank you, Chair. Thank you for your kind questions. Regarding the first question, whether the proposal is to change the current rules or clarify the existing rules, my simple answer is both. By creating additional rules, medical export restrictions will be subject to stricter requirements, such as considering the interest of importing countries or equitable share of global production. Besides, the rules offer added elements to clarify the existing terms, such as the shortage term in GATT Article 11.2a and the necessity test in GATT Article 20b. Regarding the second questions raised by Chair, whether the current WTO law can serve a proper balance between the needs of imposing restrictions and the need of free flow of goods. My answer is yes. I think there is a balanced relationship between the current WTO law and the reality of the global needs. During a pandemic, in my view, keeping well-functioning supply chains through open trade should be the optimal means to increase the overall production of suppliers and enable access to medical goods. It is especially true that only few countries can be self-sufficient in medical suppliers. However, current Articles 11.2 or Article B are only concerned with the needs of domestic use in exporting countries, without considerations of other interests of importing countries. Arguably, in my view, such restrictions are ineffective pandemic responses. That's my question, my answers. Thank you.
Thank you so much, Cai. Jingwen.
Okay, thank you, Chair. Very briefly, I got two questions. First one is, could I give an example of how it would be more gender-specific? I think the idea of gender-specific is to level the field. We are not suggesting that we should give more preference for the females, but instead we try to change what has been discriminated situation. So I will give you two examples. If we can interpret the current rules in a way to more gender-friendly. For instance, like GATT Article 6, Paragraph 1, they said the members should apply the domestic rules in reasonable and objective and impartial ways. That the so-called impartial ways could also include to exclude the discrimination against female. And also SCM Agreement Article 11B, we said the benefits thereby confirmed. We said the benefit is whether the recipient have better off compared to what they can get from the market. But if the market is not fair enough, so maybe in that way we can consider whether women can be treated more favorable. And the second question is about whether a gender impact assessment is possible. For me, I don't think it should be a legal requirement, because as I have already illustrated in my presentation, we cannot force people to do what they cannot do. For instance, the impact assessment can be hard for the different countries, so they can do not do that. But if we really want to make sure that could happen, maybe we should consider it's a procedural requirement for the WTO. For instance, like secretariats, they also prepare the papers or the factual backgrounds for the negotiation. Maybe they can also undertake such tasks, or we simply make some new procedural rules in the committees. For instance, the committee of goods, and whenever the members try to set agenda, maybe they should also enclose the impact assessment as well. So that's my suggestion. Thank you.
Thank you very much, Jingwen, for your response. Hui Xin.
Okay, thank you, Chair. About the two questions raised by Chair or the audience. For the first one, who are the beneficiary of such to use the data system for supply chain? I think if there is a supply chain data system, all countries and companies can benefit from getting up-to-date demand and supply information, especially developing countries. It is because key exporting countries or multinational companies usually have better access to market information through their larger business networks and affiliating partners. On the contrary, the system could serve as a basis or the main information source for the developing or vulnerable members or SMEs with relatively limited information access. So therefore, I think vulnerable members or SMEs will be the main beneficiary of this system. And about the second questions, for the idea of regulatory harmonization of essential medical products, I suggest that there is no more additional multilateral rules is needed at this moment, because we know from the presentation previously, WTO member has adopted some temporary measures regarding the import procedures or a product safety certificate against the pandemic. Of course, it is much anticipated that those measures remain in place permanently. But if it is not the case, I think it is more efficient to encourage those importing members to take voluntary bilateral consultation with trading partner as a first step in order to keep such trade facilitating measures between them to underpin the post-pandemic recovery. And that's my brief response. Thank you.
Thank you very much, Zaifang. Sorry, you have only 1 minute.
Sure. The core of my proposed agreement is different from the traditional way. It's more like a coordinated commitments of supports provided by countries. So it does not have the traditional thorny issues like the market access issues, those kind of protectionism issues. So I'm still optimistic about the time needed for this, because the most important part will be the commitment part, which is not commitment of the market access. And with regard to the question of CTEP, I believe that my proposal is about technology. Not just about technology, and it is also a public-private partnership ideas. So through the countries, different participating members, we can ensure more participations of private companies, and not just about vaccines, but also other important technology, but also products. Sometimes capacity doesn't need very advanced technology, and also. I think that's my time, right? So I would just maybe stop here.
I'm terribly sorry to have shortened the time for your response. Let me conclude by saying a few words. We only have a little bit more than 1 minute left. I use this very limited time to express my sincere appreciation to many people, including the Secretariat of the WTO, who has been working so hard to make this happen. And appreciation also goes to the participation of all participants. Thank you so much for your input. Thank you so much for joining us on this very, I thought, very important topic. I also like to thank our speakers who have presented quite many novel thoughts. Although realistically, there could be a lot barriers to be overcome if we are to realize all this, but definitely these are all fruitful thought for our future deliberation. Thank you so much, and we keep considering all these important questions. Thank you. Thank you very much. Bye-bye. We now conclude our session.